Check is proudly brought to you by First Capital Bank. Belief comes first.
Good morning, Dr. B.
I think we should always have a little bit of a sing-song with you before you start.
I think that's perfect. I think I should always do that. Dr. B and Susie.
That's it. I think we need to tell our backers to say, we won't do health check, chaka. We'll do a really nice, smooth, jazzy intro.
Ooh, that is so smooth, Dr. B. And it's a Sunday. How are you doing this morning?
Good. We're going to be talking, this is the month of November, or as people know it now, Movember.
Yeah.
Remember, for those that don't know what Movember means, which is Movember, it's an annual event involving sort of, I guess, the growing of mustaches
Yes.
during the month of November to raise awareness of men's health issues, particularly sort of prostate cancer, testicular cancer, and dare I say men's suicide, because men's suicide rates are going up phenomenally, and we'll talk about that on a separate show altogether. So this is basically the month where people grow their mustaches to save the money that they normally spend on shaving for raising awareness. It started in, I think, Australia or somewhere, but it's now a global movement. And so we're going to break this down, where we're going to be talking about prostate cancer initially, and if we have some time, testicular cancer, because next week we're going to be talking about the andropause, or the male menopause,
yes.
which is people have really been asking about. So let's just talk about the prostate first. The prostate, really, what is it? It's a small little, I guess it's a walnut-shaped gland in males that produces sort of a liquid that liquidizes the sperm as it travels to fertilize the egg. So it's a lubricant, if you like, a gland that produces lubrication. But we know that in all men, as we get older, the prostate gland begins to grow, and as it grows, it can grow normally and just become enlarged, and then men have problem emptying their bladder. They stand, for minutes before the bladder actually empties. That's an enlarged prostate, which is not cancerous, but it's just part of aging, and a lot of men have that problem. But the issue of cancer is where that prostate not only enlarges, but it begins to become really sort of deformed and irregular. And you can actually pick this up, which is what we're talking about in terms of November, by doing a simple blood test called a PSA test, which stands for prostatic specific antigen. Just like we have blood markers for breast cancer, you can do a self-examination of the breast by looking for lumps and bumps. You can't do that with prostate cancer because the prostate is deep within the pelvis. So we do blood tests, and they're actually very accurate in terms of picking up whether the prostate has become cancerous, because this particular protein is released into the bloodstream from a cancerous prostate, and we can actually pick it up, and if it exceeds a certain value, we know there's a problem. Now, what are the 5 warning signs of prostate cancer? Well, there's pain or a burning sensation when you're emptying your bladder. You're going to the loo very frequently, especially at night. You have trouble starting urination, and sometimes, the worst bit is when you have a bit of blood in the urine, which is what most men come to see us about, because the rest of it, they just think, I'm just getting a bit old. So it's really important to understand that. But unlike breast cancer, so prostate cancer, although there's no cure for prostate cancer that has spread, actually, believe it or not, most men actually live beyond their cancer. In other words, they die with their cancer, not from their cancer.
Yes.
It's a much more benign cancer than breast cancer in women. And so most men tend to freak out about it, but actually the survival rate is very high. More than 95 out of 100, that means 95% will survive their cancer for more than 1 year or more. And if you take, let's just say, 100 people, probably 3 out of those will have prostate cancer, of which probably 90%, which means 2 out of 3 will survive. So it's a pretty benign cancer, but picked up early, it can actually be managed very well. So that's really important. Where does it normally spread? It normally spreads into the pelvis, into the bones, into the back. There are very rare cases where it spreads very rapidly. And then you're in trouble. And those ones we get to hear about. But generally, it's a benign condition. So this is prostate cancer. How do you avoid prostate cancer? Same old stories. It's diet and lifestyle. It's improving your diet, maintaining a healthy weight, getting regular exercise, don't smoke, drink less, increase your vitamin D. Vitamin D has been shown to reduce incidence of prostate cancer. And hydrate very well, because the prostate is actually lubricated from the kidneys. If you don't drink enough water, you don't flush your prostate, this becomes an issue as well. One of the things that sometimes are confused with prostate cancer, well, there is a condition called prostatitis. which is inflammation of the prostate gland, and it's a very painful condition. It's sort of a deep, gnawing, burning pain right at the bottom of your spine, and you can't get to it, and it's an inflammation that's caused by infection of the prostate, and you require large amounts of antibiotics for a long period of time to actually get into that thing. So these are things that are dealt with by what we in medicine call plumbers, which are urologists, that deal with all this stuff, and there are lots of them around both in the public and the private sector, so people can actually go and see one of them if they have any of these issues. So that's prostate cancer, dare I say, excuse the pun, in a nutshell.
Yes, perfect pun. Dr. B, how can somebody who wants to check themselves know that they may have a tumor or something different with that area?
I think the most important thing is men know how frequently they empty their bladder. They know that the force with which the urine comes out. If you notice that, the power with which you're emptying your bladder, it takes much longer. It's sort of dribbling. It's sort of, stopping and starting. You're standing there, and sometimes men have to sit on the loo, like women, to wait until the urine comes. Then you know there's something wrong. If you're emptying your bladder and there's burning, or you find there's a bit of blood in the toilet pan, you got to go. You got to wake up and smell the coffee and go and see them. So this is important. Those are the basic signs. And of course, prostate cancer is generally one that occurs after the age of 50. So generally, men below the age of 50 are generally safe. But if you have any of these symptoms, whatever they are, you must really go and see a general practitioner. I know people, especially men, don't like to have a finger put up their bum to feel the prostate, but sometimes it's necessary, and people don't want to go for that reason, where we actually put a lubricated finger up their bum and actually feel the prostate to see whether it's tender, whether it's enlarged, whether it's dysmorphic, and men don't actually like the idea of that, but sometimes it's important. In some situations where they really can't bear the thought of that, we do an ultrasound of the prostate, but actually feeling it with your finger, as a doctor, we can actually pick it up pretty quickly that there's something wrong with that prostate gland. So that's the best way to tell.
Yeah, so between testicular cancer, what is the difference when you say somebody has prostate cancer and testicular cancer?
That's a good point, and you've left me with 3 minutes to talk about a huge subject.
Yes.
Anyway, within the scrotum, within the scrotal sac, you have these testes. These testes are your sperm banks, if you like. They manufacture sperm, and they can be infected, they can be affected, they can be injured. And the signs and symptoms of testicular cancer are lump or swelling in either testicle. It's a feeling of heaviness in the scrotum. It's a dull ache. It's pain and discomfort. Sometimes you can get backache. Now, the important thing about testicular cancer is that it is highly treatable and curable. And just as we encourage women to do self-breast testing, we encourage men to actually occasionally feel their scrotum and testes, because they know what they feel like. They know how heavy they are. They know the size, they know whether they're smooth, and if you find that you're feeling an irregularity, a lump or bump that's not there, a pain, an enlargement, swelling of your groin, swelling of your lymph nodes, you need to go and see a doctor, because this actually occurs in young men between the age of 30 and 35. You actually notice there's something wrong with you. And almost all men who are treated for testicular cancers can be cured. So this is the issue that people need to go out and check, and the life expectancy is very good, because you can actually take this stuff out and treat it with a little bit of chemotherapy, and Bob's your uncle, you better, and you can do that. Somebody's asked you, can you do a blood test like a PSA for testicular cancer? Yes, you can. It's called an HCG test, anyway, there are tumor markers that you can actually measure that can pick up testicular cancer. Somebody's asked you, can a urologist tell if you have testicular cancer? Well, they'll talk to you, they'll examine your scrotum, and they'll look up lumps and bumps and firmness, and they can actually tell you whether it feels suspicious or something. So yes, and there are lots of these around. You must go and see them. They're both in all public hospitals as well as private hospitals. So, there's no excuse in terms of cost in going to see a urologist.
Perfect. Well, Dr. B, you have less than a minute to close up. You're laughing. You have less than a minute to close up the issue.
I think to close up the issue, we always say this, that women look after their health far more than men.
Yes.
I urge men, particularly in the month and commemorative month of November, to take charge of their health. It's not just about prostate cancer. It's about their weight and their stomach and their eating and their alcohol and their exercise and treating their spouses well, and there's a lot of stuff that men need to take charge of, so I urge all my compatriots there in the male domain to listen, pick up your case.
I think there's somebody who's trying to get to talk to you right now, Dr. B. So let me put them through. You're live on Yarna FM. Hello.
Hi, Dr. B. Rapula in Lubase. How are you?
Yeah. I lost Dr. B. Let me try get him back. What happened? Yes. But I lost him. Hey, please hold on the line for me. I have no idea what just happened, but I lost him. If I can get him back, that would be great. But please ask your question so that when I do get him back, we'll be able
just
to talk.
ask him. When you squat and as a man, when you squat and you pee, does all the pee come out at one time compared to when you stand and pee? That's my question.
All right, cool. I'll definitely get Dr. B to answer. Thank you, Rapula. I have no idea what just happened, but I lost Dr. B. It is time up though, but I will definitely make sure that next week we get an answer. It's 11:50 on Yarna FM. Live the music. That was Health Check with Dr. Baggett and myself as we covered prostate and testicular cancer. He wanted to say, which I'm sure is that women take care of themselves medically more than men. We are always out here trying to make sure we are okay because from, young, we are told, take care of yourself. And men, like he said, have this fear of, things being put in weird places. And so we're just going to close it up like that. I can't wait to hear more about Dr. B and definitely Rapula. I'm going to ask him about that squatting question. Make sure that you join me next week on the House of Zoo, Saturdays and Sundays from 9 until 12. Festivi Qadile. Let's be safe. Let's enjoy ourselves. Yarna FM, live the music.
Health Check was proudly brought to you by First Capital Bank. Belief comes first.